22 right now. Okay, folks, this is something I think a lot of us have heard about, stomach acid, and it could cause problems like heartburn, a lot of burping, and a lot of discomfort. I know that sounds gross, but it's real. But it could travel all the way to your throat. Dr. Susan Schwartz is joining us live with more on the difference between acid reflux and laryngopharyngeal reflux. That's a big word there. Doc, how you doing?
Good morning, Monica.
Okay, thanks for being here. First of all, LPR is the acronym for it. Tell us what laryngopharyngeal reflux is.
Well, Monica, LPR is, when we eat, we swallow our food. It's supposed to go into our stomach.
Right.
When it goes in our stomach, we're supposed to digest our food. But what happens in LPR is that the food actually comes back up into the food tube or the esophagus.
Oh, boy.
And what happens then is you get the complaint called heartburn that you're familiar with, or GERD.
Okay.
But what happens in the ear, nose, and throat world is the acid comes up as high as the voice box. So the patients don't come in complaining of heartburn. They come in with symptoms in their larynx.
Okay.
So they say, doctor, I have a chronic cough, I can't swallow, I have a lump in my throat.
Okay.
Asthmatic patients will actually get worse on their medical therapy.
Wow.
Because the acid irritates their larynx.
Okay. All right, and so people with asthma, it can go really bad for them because they're already having a difficult time breathing.
Absolutely.
Okay, let's talk about some of the symptoms because this is a really, I love this slide that you sent us, manifestations of silent reflux. Again, this is laryngopharyngeal reflux, not the regular acid reflux that we talk about. So we'll pop that up for you. Talk about that one, what the symptoms are.
Well, the symptoms, as I said, the acid comes up to the throat or the voice box. So the patient will actually have symptoms of a lump in their throat, that they feel like there's a foreign body stuck in their throat.
Yeah.
So they'll come in with frequent throat clearing. And they'll say, Doc, I feel like there's something stuck there.
Okay.
Okay, and they'll also have hoarseness. They'll think they have something like vocal cord nodules or another problem.
And we hear that a lot with a lot of the singers, some on the strip, right?
Absolutely.
Yeah. Okay.
And a lot of them are treated for underlying reflux as well to help control their voice.
Okay. All right. So how do we stop this? How do we fix it? How do we make the changes?
Well, you know, we diagnose it by looking, okay, in the office first. And we'll look with a scope. And we'll look down into the voice box and we'll look at the tissue.
Okay.
And the tissue might look swollen or red. And that would suggest LPR reflux.
Okay.
Okay. Sometimes we'll do a pH probe where we leave it in for 24 hours, but it's not really necessary to do that test.
Okay.
And then that would give us the answer. Where is the reflux? Is it up to the larynx or is it just in the stomach?
Okay.
Is it GERD or is it LPR that we're discussing today, which is higher up in the voice box?
Yeah, and left untreated, that can cause some major problems.
Absolutely.
Right? Okay. Well, Dr. Schwartz, thank you so much. And folks, if you're ever in her office, she's treated Garth Brooks, Ozzy Osbourne. You know, she's hanging like that, Jason.
I just like the word GERD. It just sounds like something. No, I think you're right. I wouldn't like it if I felt it. All right, thanks, guys. Forget the pooper scooper.